longer news that the state of depression in Nigeria has affected the people in various negative ways. There have been cases of suicides and suicide attempts that has been in the country of late, and this has raised the red flag in the health sector. On today's episode of Street Files, we want to find out from Nigerians what they think about depression and how best can we overcome depression. This is Street Files brought to you by Manifest Apparel. I'm Kuku, and I say stay tuned.
This episode of Street Files is brought to you by Manifest Apparel.
What do you think about depression?
Depression is a very bad thing, and let me tell you the truth, it's a very bad health condition.
Setting too much high goals for themselves.
Because of various issues happening in their lives. When things are not going well for the individual.
But then it doesn't really stem from the medical aspect. It stems from our day-to-day living, our lifestyle, the things we face, the hurts we go through.
Especially when their expectations are not met.
Which at the end may be difficult to achieve, leading to depression.
It may come maybe through sickness, it may come through spiritual attack.
Okay, how can you help someone overcome depression?
Okay, I would say number one, getting in contact with the person, like trying to get to know the person one-on-one, tell them it's not good for them, and let me say a conscious advice and a conscious effort to help the person.
By making them understand that you may not be able to have what you need all the time. So we should not over-expect from ourselves or from the society.
The only way I can help the person is through the word of God. Because if I should take the person to a clinic now to treat the depression, it will come back and still be depressed more.
I don't really believe in going to the rehab or going to see a shrink, that's a psychologist. I feel you should talk to the person, and also the person should should take a step. Because everything about us as humans, you can limit yourself from within. Understand? You should be able to take steps on your own to say, okay, fine, I need to get out of this thing.
To overcome depression is to take life the way it comes. Take things so easy and believe that one day your time will come.
Spiritually, you can take him to church. Good counseling. I think these are the areas that can reduce depression.
We've heard from different people as they share their opinions and views about depression. So now we're going to link to health experts as they shed more light about depression and tell us how best we can overcome it.
The truth is, depression is a serious mental health condition. It is. I need people to understand that the word that we use carelessly, like, oh, I feel depressed, oh, I'm depressed. They should really look into it rather than using that word. They should know that it's a medical condition and it is a serious mental health condition, not just a medical condition, because it comes with a lot of symptoms, signs, and other consequences and all that comes to. So it is a medical condition that needs to be diagnosed. It comes with persistent sadness. We're not saying sadness for a day or two. We're talking of sadness for at least 2 weeks. It comes with low energy level. And then the third one, which is one of the major symptoms and very serious one, is loss of interest, things ordinarily you love to do. Things you enjoy doing, things that gives you pleasure. You just find out that you are no longer interested. You are going to work, you don't like to go to work. You love to watch movies, don't want to watch movies. You are just there. So these are the 3 major symptoms. And then we have numerous minor symptoms. And we need to understand this, that it's not just major symptoms we have. These minor symptoms comes as small as not eating well or even overeating.
Yes.
They're not sleeping well or oversleeping. You see, the person wants to sleep, his problem or her problems away, and of course it's not going. Depression, you can't will it away or wish it away. Loss of loved one is a major traumatic life experience. A lot of people just gloss over. A woman's husband dies and then everybody comes to her house 2 weeks. After 2 weeks, they disappear. Poor concentration and attention, guilt feelings. Sometimes the person starts feeling hopeless and worthless. And at severe forms, you see some people start hearing voices or seeing strange things in clear consciousness, becoming paranoid, what we call being suspicious of people. This person wants to poison me, this person wants to harm me. And these are all ways that we talk about the major and minor symptoms of depression and let people knowing that depression is a serious mental health condition. The good news, yes, there's treatment. Depression is treatable. But the most exciting thing about it is that not all depressive illnesses need a psychiatrist. Depression is in 3 forms: mild, moderate, and a severe form. Mild depression doesn't need medication. That's it. It just needs talk therapy, counseling, encouragement. That's why we say when you notice these symptoms we talked about, talk to a trusted friend or you get to talk to a therapist. That way you'll be able to know, okay, this is what the problem is. The person will give you good advice. And that's why we say, if we talk about it, people around you will also know what to do. And know the beauty about it is that when everybody is talking about depression, what it is, what you need to do, how you need to support people, you will be able to encourage and then help the person get that treatment. It's when we are now going to moderate severe form, when the person is suicidal, when the person is a bit violent, when the person is paranoid, when the person just feels that everything is an effort, not eating well, not sleeping well. Sleep deprivation is a gateway to most psychological issues. So your primary contact is your primary physician. Nigerians, please, we need to understand that. Your primary physician, don't go looking for, I must see a psychiatrist first. If you do have opportunity already knowing one or you know exactly where to go to, awesome. But please don't look at it that I must get a psychiatrist before I get treatment. Meet your family physician who will say, yes, I've noticed this about you and I need to refer you. I keep telling people, no, antidepressants are not for life. No, antipsychotic are not for life. If there's a reason why you have to be placed on it, you'll be told. And if there's a reason for you to continue, you will also be told and you will be encouraged. If you start with 2 tablets today, in 2-3 years' time, if you are still taking medication, you may be on half tablet or you may be on 1 every other day. So there are rooms. That's why follow-ups are key. Having a relationship with your doctor is very important. Going for your follow-up, taking your medication as prescribed. If you have any issue with it, discuss it. So yes, depression is treatable, and there are, you've heard, you've seen, there are loads of resources out there. Yes, we are still a work in progress, but at least the little we have, let's make do with it.
There you have it on today's episode of Street Files. Please, let's try and help someone overcome depression today. We're celebrating World Health Day, so let's help somebody overcome depression on this day. For more, go to www.connectnigeria.com or check out our videos on our YouTube channel at Connect Nigeria. I'm Kuku, and until the next episode, stay connected.
This episode of Street Files is brought to you by Manifest Apparel.
If you like the video you just watched and want more, subscribe now. To watch more videos, click on Watch More Videos.